Welcome to Romera Records Virtual Cast. Today we have on Dr. Jared Nelson. How's it going?
Going good, man. Thank you for having me. I'm excited to be here and talk, man. I'm excited.
Yeah, so I actually saw you. So we were Facebook friends, and which I hadn't seen you on Facebook till maybe a year ago or less, maybe a few
Hmm.
months ago. And I don't know if you sent me a request or I sent you one, but I hadn't seen you or talked to you since Gold's Gym back in like 2015.
Gold's Gym, man. Back in the day, working out, man. That's what it's all about. Yeah, we were there for a little bit and big into the fitness arena, big into the fitness and all that. But yeah, it's been a good while. I think like 2012 to 2015 is when I saw you there,
Yeah.
something like that. But yeah, it's been a little bit.
So I guess I just wanted to understand like what you do now and really like how you got to that point because I think were you still in school when I met you back then?
I was, yeah. Graduated high school in 2010 and then went straight through the nursing track. So from 2012 through 14, I think we met around 2012 area, 2011, something like that. Was in school from 2012 to 2014, getting my bachelor's in nursing, doing that. And then in 2014, started working as a nurse and all that. So during that time, I was in school. Yeah. Yeah.
How was school back then compared to like what you see people coming out of school now? Does it seem very similar or do you like, man, we had it hard back then?
Yeah, I mean, I think nursing school in general is hard. I was in a bachelor's program. Bachelor's in nursing is pretty rigorous, I would say. I'm gonna dim this light just a little bit just to make sure y'all can see me pretty good. One sec there. But I mean, yeah, that's a lot better actually. Nursing in general is tough. I think if you talk with anybody in nursing, that's went through the nursing degree in any capacity, it's a tough field. Um, Whether, some people get their associates, they get their associates in nursing, they work as a nurse for a while, you can level up and do all that. But I knew I wanted to go beyond. I knew that nursing for me was kind of a starting point for me, so I wanted to get my bachelor's and do that. So that's kind of what I did getting my bachelor's. Now, as far as was it easier now, harder then, there's a nursing shortage. I mean, it's a reality. I'm not sure. I wouldn't say that nursing schools push people through now, but I think in general, some nurses that I see aren't as prepared as they could be prior, probably 10 years ago, something like that. The pandemic changed a lot of that. But overall, I think nursing's good, man. It's hard, it's rigorous no matter what you do and where you do it. Um, but nursing school compared to then versus now, I think then it was probably a little bit tougher, in my opinion. That's just my opinion.
That seems like I would say most school has gotten easier, but
Mm,
I, I feel that way because technology. Like,
true.
I don't think schools have understood how to make classes harder because of technology. Because, so I just did a podcast a while back with one of my former teachers from high school. And I think when we were talking, she was the elementary principal. And I was asking her, like, how has AI affected schooling? And she was telling me about, telling the students not to use it or blah, blah, blah. And I thought that it would be a great idea to just make school harder because now the students have access to something that can assist them. So I was like,
Hmm.
you just make the school harder and just,
Yeah.
yeah, y'all can use whatever AI, Google, just use it all. But we're about to make your curriculum a lot more difficult.
Sure. Well, that information is so readily available. If you think about our parents, had to have a typewriter. I mean, depends on how old they are. You had to go get the encyclopedia. So people don't even know what that is anymore. I mean, now it's every piece of information, everything is readily available. Chat GPT's changed the game. I
Yeah.
mean, research paper in a couple of minutes, cites, or citations, all that done. I mean, it is easier. It's way easier as far as information is so readily available. And with any growth, there's struggle. Is there struggle through learning now? I don't know. It's just changed. And I don't know necessarily the answer to that. I think educators could more present that in a better way. But the education game, yes, definitely changed. And technology is a great thing. I'm a big advocate. I do a lot of telemedicine online visits with my patients and clients and everything. Love doing that. But technology's here and it's not going anywhere. And if anything, it's going to keep advancing. It's something that we got to kind of roll with and adapt with for sure.
So something that always interests me about people having the access to information, especially with people in the medical field, is self-diagnosing. And
Oh yeah,
I would love
Dr. Google, Dr. Google.
yeah, I would love to hear any kind of stories you have with working with people who, they have some sort of issue and they're telling you what their problem is.
Sure, sure. It's very common. I will say in the age we're in, it's very common, but I think it's good that patients are informed. I'll kind of put a spin on that and say that because I think before, think of the early 1900s, people were just like we had a little apothecary guys coming around saying, take this snake oil and you'll feel better. Everybody believed them. There's no information to determine whether or not you should take. Now we have the information everywhere, and that can be a blessing. But on the provider side, it does make it more challenging because um, there's just a lot more questions. Now we go to school, we're trained, we know what to do, we know the outcomes of things or the expected outcomes of things, and that's why we do the interventions and the things that we do. But there's just a lot more in-depth questions from patients. And to some people, it kind of rubs them the wrong way. Some providers, oh, you're questioning what I do. To me, unless it's an extreme limit, I'm like, I'm cool with it. You can ask questions and all that. I think the patient's being informed is good. But kind of where I draw the line is them telling me what to do. And that's happened a time or two. Like, if we're addressing an issue, say for instance, like certain antibiotics are needed for certain diagnosis, bronchitis or like cellulitis, a skin infection, something like that. And I know specifically what antibiotics cover a certain bacteria. But the patient says, I saw online that this is this and all that. Well, that could be true, but also I have clinical experience that I've given this antibiotic to patients. I've seen it be effective and it works. So there's kind of a rub there sometimes. But overall, I think, patients are more informed more now than ever, I would say, which can be a good thing. But sometimes if you don't know much about it, you could see just a fact, but you don't know the whole depth of the problem and how to treat a condition, stuff like that. So that's where kind of the problem comes in there.
Yeah, I mean, I think it's as you said, it's great that people are now more informed. They have more information on how to help themselves, and that actually helped me out. I made a post about this a while back, but in was it last year? Yeah, last year in May, I had a PE, and basically what happened was I went for a run one day, and my right calf just started hurting. Like it was sore, but I was like, okay, I'm sore after a run because I don't usually run. I just go work out. And so after the run, it was hurting, but then it got better, and then it got worse again. And I was like, this is odd. This isn't how it usually works. You just get sore and then it gets better. But okay.
Sure.
So about a week goes by, and like I'm limping at this point. And so I go to the VA and they check me out and they're like, "Well, you don't have a blood clot, but it seems like you might just have like some soreness from like an injury that you had, like you maybe have a muscle strain in your calf." And I said, "Okay." Because it hurt so bad. Like they were trying to like grab my calf and I about kicked them. Like it
But
hurt.
see, that's the thing being a young person like that, like that's not normal. Having a reaction like that, and you lift weights too before and all that. I mean, that's kind of understanding the patient population too and understanding that. But anyway, kind of interrupted your story there.
You're fine. So I ended up, I needed to go out of town. I took a flight. So I take the flight, I go out of town that weekend, then I come back. And then the next weekend, I end up going to my parents' house. So I'm currently living in Memphis, but I end up going to my parents' house back in Aniana. And so I'm there for that weekend. And while I'm there, like I started having like pain in my side, my right side, and just weird feeling in my chest. And I was like, okay, this is odd, but let me sleep on it. And then I could barely sleep one night and noticed some blood in my when I was like blowing my nose. I was like, yeah, this isn't right. So
Hmm.
I was like, maybe I need to go to the doctor. So I ended up using Chat GPT to I put in my symptoms and it was like, hey, you probably had a pulmonary embolism. You should seek medical attention. And I was like,
Mhm.
okay. So I ended up going to the doctor and that's what happened. I had a pulmonary embolism and it was bad. Like I was in the hospital for I think it was just a night. Like I went in the morning and then I didn't leave until like the afternoon of the next day or evening of the next
Mhm.
day. But yeah, I thought I was a goner and they said you're lucky to be alive because they were like this usually kills a lot of people because it just happens so quickly and they don't even know it. But it was pretty rough, I'm not gonna lie.
Yeah, we call that kind of a black swan event in a way, just because of age, and that's not a very common thing for sure. It's uncommon, but that just goes to show. I mean, things can be missed. It's unfortunate, but and that's why I have emergency medicine background. We might get into that kind of my background and everything, but I worked emergency medicine for about 6 or 7 years. But you just always have to make sure. And there's a balance of cost. I mean, we can order MRIs on every single individual that lives in America, and that's possible. And we might clear and find stuff and all that, but you have to balance cost and then risk. You have to know, and obviously, based they took a risk and said, "Nah, he's good" or whatever. But obviously, that risk was a bad risk to take. But very uncommon diagnosis, especially for your age. That's pretty rare. That's pretty wild. But PEs are dangerous. Yeah, start as a DVT, deep vein thrombosis.
Mm.
So a lot of times clots start in your leg, and often when people have a pulmonary embolus, that's where it starts. And so the clot is in the leg and it travels up into the through the venous system into the lungs and all that, and that's how it can become dangerous. But yeah, that's a pretty wild story for sure.
Yeah, so on the topic of you talking about basically the cost and trying to figure out everything, like how much is that like harped on when you're just getting educated in like schooling and stuff like that? Or is that something you just kind of have to trial by fire and just figure it out when you're in the field?
Yeah, it's trial by fire. I think when you see a lot of providers, especially come out of school, they want to order everything because it's kind of like the clinical understanding. You can't replace experience. I don't care what computer, I don't care, it doesn't AI, it doesn't matter to me. A human being with clinical experience supersedes everything. And without that clinical experience, you really don't know. I've had physicians discharge people from the ER with chest pain. They have chest pain and stuff. And it's like clinically, we know. We know from their signals, we look at their vitals, even a feeling. We call it a feeling. That's kind of scary to some people. But if you've been doing it for so long, you just have a sense for these things. That's why you're valued and paid so much money and all that, because it really is an art in what you do. But as far as cost in school and stuff, that's talked about. It's like don't just order every test known to man and all that. Be more specific. Find out what's going on. But just depends on a lot of things for the patient too. I oftentimes, if I'm talking about something or I think I want to order something and the patient is uninsured, they don't have insurance, I'll have a conversation with them. Say, this is what I think. This could be it. We could also order this and waste your money. It's
Mm.
possible. We could do that. That's possible. But I think it could be this. I'm going to leave it in your hands. I think we should order it. What do you think we should do? And so then it goes on the patient gets to make a decision. It's not just me saying I'm going to order this and rack you up debt, do all that. I'm just more of a logical person. It's like talk to the patient. Tell them, hey, this could be this. As far as cost, we need to do this test, all that. Let them make that decision. And then if it goes wrong, it's like, that's what I thought we should have done and all that. But I give a lot to the patient. Now, if it's something 100% that I know for a fact it is, we need to do the test. And I'm going to say that. But a lot of times to balance that out, I bring it all to the patient, my medical experience, what I know about the condition, and I give it to them. This is what I think we should do. Is this something you want to do? There's a cost involved. And I kind of put it in their hands a little bit.
Yeah, that actually recently happened to my wife. Like she, I think went to the gynecologist or something, and she was trying to just figure out like about some. I think she had some cherry angiomas. I think I'm saying that right, where she was like blood like coming up to the surface of her skin.
Mm-hmm.
But she was just trying to figure out if there was anything, going weird. And so they ended up getting a test done, and she said she got a bill in the mail, and it was like it her cost was like $1,000 that she had to pay, but the total
Wow.
cost of the test was like $6,000. And they never told her that it was going to cost that much. She was just like, they just told her, "Hey, let's run this test," and then she just did it,
Hmm.
and then she gets this bill for $6,000, but she only had to pay 1,000 something out of pocket, and she was like, "This is corrupt." Like, this is
And that was with insurance?
yeah. With the insurance, she owed a
Yeah.
thousand and something, but the
Yeah.
actual cost was like 6,000 from, but the insurance covered the bulk of it.
I'll give you a hack, and I'm all about people being insured. I think it's very, very important. But if you're uninsured, you can go to a doctor and just pay out of pocket. And the cost that you see on a bill is exactly like you said. The insurance companies, they charge them so much money. But if you go do a test, like I had my gallbladder out, that's kind of personal, I'll just say it. And at the time I was travel nursing and I wasn't insured. So I went to the hospital directly and I said, what will be the cost for me to pay out of pocket? And it was like a tenth of what the insurance would have been billed for it. Now, people go to school to understand insurance, and I know a lot about it, but the ins and outs of all that, I really don't know. It's crazy. It's crazy. But that's a hack, man, and it's crazy. The cost of medical expenses and procedures and all that, it's through the roof, and it keeps going up.
Have you been educated on like other countries and the things that they do compared to America?
Some, with Canada, a lot of their stuff is free and in different countries, but we look at the quality. That's the key. Sure, it's free, but that's the beautiful thing about medical stuff in America. It is state of the art, first line, and all that. And it's because things cost money.
Hmm.
Because, and that's why providers get paid what they do. Their training is so much more rigorous. They're so much more understood in things. Most providers, I would say. I've seen some that's kind of questionable, honestly, sometimes, but supposed to be. But that's kind of the difference that I've seen. The reason that it does cost so much more is because you're paying me a premium for what's supposed to be a really, really good product. Just like if it's a product, either you pay a low amount, you could get a great value, you can get something, or do you want to go, name brand, get the real thing? And it's kind of the same way to look at it from a medical standpoint. I think that's why it's so different. But I know that about Canada. As far as other countries, I'm not really keen. And no, I know people go to Mexico to get a BBL and all that, but as far as other stuff, I really don't know too much.
Yeah, I talked to a surgeon one time about Canada's system, and he was telling me like they have a certain amount of surgeries that they're allowed to do. I don't know if this is like
That's
per
right.
doctor or it was like in a year. And I don't know if it's like per doctor or if it was like per the whole country of Canada. But he was like, let's just say they're going to do 2,000 heart surgeries. He was like, after that 2,000th heart surgery, you have to just wait. And I was like, oh my God. He was like, yeah,
Yeah.
that's the difference between in America is like if you got the money, they'll take it, they'll do it. But in there,
And that's a great point, and that's why we need to look at that. Everybody wants free healthcare, and I'm all about it. Like if we can make it happen and all that. But we had Obamacare. We had Trump even try to come in and say he couldn't fix it either. We had all these presidents trying to. Nobody can fix it because I don't think it is because the cost has to be there. The reason they limit surgeries is because they don't want to pay for it. The government doesn't want to because they would have to pay. It's government funded, so they would have to pay for all those surgeries. I really hope people understand that, and it's not a perfect system. I really wish every single person could get health care for. I really wish we could, but there's a cost. There has to be incentive for doctors to go to school, nurses to go to school, these people and go into debt to get these degrees to do what they do. They have to be paid well, and there's a cost associated with that. I think we have to have that conversation and understand that. I really wish, though, healthcare could be free for everybody and all that, but there's a cost associated with good healthcare.
yeah, and something that I've always been harping on is like people don't mind paying taxes. It's the fact that we don't know what the taxes are going toward. Like if
Mm.
you told people like, "Hey, you owe this much in taxes," and then you get a choice in what those taxes go, like people will be excited about taxes. Could be like, "Oh yeah, I pay these taxes and they give me blah blah blah." But like that's the problem with like healthcare is a lot of people are like, "I don't want to pay for like socialism or whatever type of community, government, people are like, I don't want to pay so that somebody can just do nothing and get benefits. But if you had a system to where like your money went to something, only things that benefited you, then people wouldn't mind paying into that.
Sure. I don't think so either. But I don't know if you want to get political in here or not, but the spending, the cost of everything is just astronomical. You know, Columbus crossed the river, the giant river, for like a 3% tax or whatever, or like the Boston Tea Party, all that. These are 2% tax on tea and revolt, and we pay 40%. You
Yeah.
know, like, and we don't blink an eye. It's kind of crazy, but yeah, government spending. I don't know how you feel politically. I'm kind of neutral with a lot of different things, but our new administration, what they're trying to do, you know, from what I see, they're trying to do is try to turn a lot of things around financially, and I'm all about that. But yeah, taxation is it's a touchy subject from a lot of it. Some people call it theft. You know, I don't know if it's theft. I think we need roads. You know, we need roads. We need a little management of things. But as far as trying to run our lives on a day-to-day basis and taxes, I'm really not for that, honestly.
Yeah, I mean, I'm kept abreast of like Doge. You know, they say Elon and Vivek are doing Department of Government Efficiency. Like, I'm all for anything where we're trying to basically be more efficient with spending for sure. I mean, we're
Sure.
in like, what are we in like $30 trillion of debt now? Like,
I can't even count that high. Like
yeah,
I can't even count that high. Yeah.
it's monopoly money at this point.
Yeah.
So I think
Mhm.
definitely need to do something to where we need to take it more seriously as far as like where our money is going to. And as you said, like we can't do the free thing because it just I don't know. In America, it almost just doesn't make sense as far as like how Americans spend money and I hate to say it, but the entitlement of Americans as far as like if you told people that we were only doing 2,000 heart surgeries in 1 year and that's done in like August and they have to wait until January to get their heart surgery, people would explode. But
Yeah.
but telling them they have free surgeries, they'd be like, "Oh, great." But then you tell them this is how the system works, they would think this crazy. So there's definitely it's impossible to please everybody. That's really the problem right there.
Well, that comes with good leadership and hard decisions. I mean, I think that's just a leadership quality. You're not gonna please everybody. That's impossible. You know, so hard decisions have to be made, choices have to be made. Hopefully for the betterment of everybody at the end of the day, but that's always the choice. Going back to the surgeries thing, you know, I said people go to Mexico to get BBLs, but even in America, people have surgeries very, very quickly. You
Mm,
know, I'll have patients say my back hurts. 30 years old, 25 years old, my back hurts and all that. I want to see a spinal surgeon. I'm like, you're 25, man.
mm.
Like you really want to have a consultation for back surgery? I'll do it. And that's another thing that I do. If a patient requests something, most of the time I'll give it to them. Like I have no problem with it if they want to go see a spinal surgeon or whatever. But I try to give some people counsel. Every surgery has risk. Every single procedure that you do, every medication you take, everything you do has risk. And the American way that I've seen, you know, just from practicing for the time that I have, is people want that quick fix, you know. But the quick fix most of the time is not the best thing. It's really not.
Yeah, that's something I could definitely look forward to in our healthcare system and which even RFK, he's trying to help with food and that's something that I really hope our doctors and physicians and everybody they start looking for those alternative answers and solutions for people who have medical problems. We've been hearing people which I suggest to people if they want to find out what's wrong with them in a short term to go on like an elimination diet. I'm a big advocate of the carnivore for like a short period of time. Not saying do this for a lifetime at all, but like maybe 2 weeks or something like that. And if you feel great in that 2 weeks of changing your diet where you're just like eating just meat, introduce bread, introduce, a leafy green. And then once you introduce those new foods, you'll find out like, oh, my skin breaks out when I have dairy. My skin breaks out when I have leafy greens, something, because
Mhm.
maybe like just putting ointments and taking these pills isn't fixing you. Like you just need to find out what's actually wrong with you.
Well, you're covering up the symptoms. I think that's a big thing with mental health. If you want to get into that, the prescription of mental health drugs, rampant. I mean, SSRIs are prescribed so commonly, and I actually prescribe them sometimes in some situations, but you're covering up problems. Like the medicines are designed to stop the symptoms, but maybe there's an origin to where the symptoms are coming from. Maybe it is gluten. Maybe it is lactose. Maybe it is something that you're even ingesting that's causing the majority of your symptoms. Maybe even just look at that. But self reflection is a huge thing, self assessment. I think people commonly don't do that. Again, going back to the American way, let me go just talk to somebody real quick, get a pill, and I'm good. Rather than making change, changing something about your life, which is painful. Change is painful. Just go somewhere and get a quick fix. But yeah, covering up problems with medicine, very, very common thing in today's time.
Do you have like a timeline that, you said you'll do whatever, if somebody asks for a consultation and for back surgery or whatever, but like, is there like a timeline that you have found that's like, okay, once you have gone through this therapy and we've done all these tests, then we should really consider a surgery?
Sure, it depends on the history too. I mean, if there's a 25-year-old that just hurt their back, and they're like, my back's killing me, let's try some anti-inflammatories, steroid, try some different things first. Let's do chiropractor. Let's try some other stuff. And that's just for back pain. That could be for a lot of different things. Try some other methods first before going under the knife because honestly, like I said, people just, it's crazy to me. The amount of people I hear and ask for surgery and all that. And if they're insured and they really want to pay for it and that's what they want, I'll advise them, hey, I would not necessarily go this route, but if that's what they want, that's their choice. I'm not going to tell them not to do it, especially if then the surgeon says, sure, you're a candidate. If they really want that, that's their life. But I took a vow and ethically, morally for me, to take care of people. And I just do it the best way that I know how. And I think honestly, having surgery for a lot of these problems and a lot of these complications should not be the first resort.
Yeah, and I think that those are the type of doctors who you can tell are actually looking out for you and not just
Hmm.
trying to like phase you through their process to get as many
Right.
clients as they possibly can because it's something about just being inquisitive. Like if I have a doctor who's asking me even just random questions, like, what's your daily activities, stuff like that. They're really trying to get down to the nitty-gritty of why you're having this problem. And if your doctor is just like, just do this and you should be fine, or then I feel like they just don't really care about you.
Yeah. And I think there's some providers that don't. And that's the sad reality. A lot of people have bad experience. You go to a medical provider, you can tell they're just there. They don't care. And so you develop this idea that the medical system's rigged, that no provider cares and all that. And that's what I've tried to change, especially in my practice when I see people. I've tried to change that. I think there's providers out there that really do care. They really do. Some people show it in different ways, and there's bad everything. I mean, there's bad every profession. But I think there's a lot of good providers out there. And if you've had a bad experience, with a medical provider, maybe give it another try. Maybe try it again. I think there's some good ones out there. But I always try to let people, too, like I said earlier in the podcast, kind of be involved in the decision making. If you go to you go to a medical provider, sometimes they say, here's what we're going to do this, you're good to go. Why not let them be a part of that process? Make that choice. And think about just in general, like if you get to choose to do something, if you make a choice and you actually choose to do it, think about how much more likely you are to do it, to be compliant with it, to have a better outcome versus me just say, hey, go do this. Trust me, bro. Trust me, bro. Like the compliance probably is not going to be that great. So I always like to tell them, educate them. This is what I think from my training, my expertise. This is why I believe this. I think you're going to have a good outcome doing this. And I mean, compliance, I have no issue hardly at all with it because I give patients that choice and let them be involved in their decision making.
Mm. Yeah, that's a really good point. Like when people have the option to really voice their opinion and talk about their choice, they they just feel better about the choice. Like
Right.
when you're actually involved with a decision, like you just I don't know, it just seems like it's gonna feel better. It's just gonna go well because it was a collective decision. It wasn't just somebody telling you to go do it.
Yeah, even about, diet stuff. Like if it's telling eat better, do this and all that. Like what kind of foods do you like? What kind of foods, what can you not go without? Like what do you gotta have? And kind of build a plan. Even that's just diet, for example, but that could be used for anything. Just kind of build a plan that they're going to be compliant with and that they want to do. Because if you tell somebody that's ate this, they'll just say donuts, their whole life. They can't go without it. They cannot go without it. They're going to keep doing it. Why not limit it? Let's limit it. Cut out this other stuff that's just empty calories. You can have one donut or two a week, whatever you have to do. But at least they're involved. They still have something they enjoy in moderation that's mild, and they have a better outcome versus just giving them a sheet that says, "Here's your diet instructions." Nobody's going to follow that. Nobody's going to follow that. I've seen that from practice, and obviously making the change. I've seen the difference that it's made in my patients too.
Yeah, I've heard that a lot is that whenever you tell somebody the things that they can't do, they're more likely to be rebellion against it. But if you just like instead, like you said, with the donut thing, instead of somebody telling somebody, "Hey, you can't have donuts," just say you can have a donut a week, then they're more likely to get just really excited to have that one donut, and then they're also going to feel accomplished and successful that they're only having that one donut a week instead of being like, man, I can't have donuts anymore. Then they're just going to get sad and depressed, and then that diet is just gonna crash, and they're just not going to want to do it.
Exactly. I mean, it's human nature. When you're told not to do something, you kind of want to do it. I mean, it's just,
Yeah.
I guess it's the kid in all of us, just the kid in all of us who just want to, yeah. So, I mean, it's more of making a plan rather than saying, here's what you can't do. You cannot do this, you cannot do this, cannot do this. Here's what you get to do. And then the change is the outcomes that we're going to see. I think just reframing that mindset and changing that way of thinking really can change a lot of things. I really believe so.
So something I also want to get into is your podcast. So I only listened to like one episode so far, just because I listened to a few and I've been kind of rotating them. But um, what was the one? It was the guy who had like a family situation where, um, gosh, what was it? It was his relationship with his dad.
Yeah.
I can't even think.
Hmm.
Look this up.
Yeah, yeah. It's okay. I think it was Ian Grimaldi is his name. He actually changed his last name recently.
Yes,
Shout out,
that's
bro.
what it was.
Yes.
Yeah, it changed
Yeah,
his
yeah, yeah.
because it was like he didn't want to be associated with what his dad's last name was. That what it was?
Yeah, that's what it was. Yeah, had a kind of a violent, I would say, fallout with his dad. Something that he eventually has had issues since childhood, with his father, and he just said, it's best for me that I change my name and create my own path. And that's kind of what he decided to do. Hmm.
Yeah, that was a pretty good podcast. And that's what really that again, that was the first and only podcast of yours that I've been listening to. But I think that conversation was really cool and a good introduction to who you are and your podcast. For anybody who's listening to this, like go listen to that podcast. But
Sure. I'll give you some links if you want to post in the description or whatever else. You can check it out. Yeah, yeah,
and I think that was a great one just because it showed I think sometimes people don't know how to be vulnerable on especially in public, like on the internet. And that really showed like one, you were allowing him to kind of get into his personal life and you could kind of tell like he wasn't sure like how deep you wanted to go into it and you were just like, yeah, just go ahead. Just say
yeah, yeah.
but I think that's awesome that your podcast is like that because sometimes people their podcast is a little too shallow and that's why I love mine is because I let the person go as deep as they want to in the conversation. So if they don't want to talk about something, fine. But if they want to talk about as much trauma or whatever, we can cry and go into whatever. I don't care because I
Sure.
think everybody has a story, and I think sometimes people just need to hear some of the bad things that happen in people's lives so that everybody can have that kind of person to be like, man, that happened to them too. So I think that was awesome.
Mhm. Well, relatability is huge and just overcoming. That's what I love to see. All the guys, the podcast is called The Better Man with Dr. Jared Nelson. And again, I'll give you, if you want to post anywhere, the links, whatever you want to put down there. But it's just hearing these stories of guys, some I grew up with, some I don't really know very well, but getting them in there, talking to them and kind of hearing their story and how they've overcame things and are successful in life. Because, like you said, we all have a story. We all have something. Even very successful and stable childhoods, there's some form of trauma. There's some form of something that you've been through. And I think just seeing that, overcoming that, it's just like you said. I can relate to that. Like I saw that, I can kind of see in a way that's me too. And so, just starting that podcast, kind of a side thing that I do on the side. We talk some medical stuff over there, but mainly it's just getting some good guys in there, spilling their heart, man, talking about stuff, how they've overcome, how they've made life better for themselves, and it's been a really good time. About 42 episodes deep, so it's moving around along.
So why did you start that podcast? Was it just something that you just felt like it was it for you, or was it more for other people, or a little bit of both?
Well, I don't know if you want to talk about spirituality, Christianity. I'm a Christian. I feel led, even doing nursing, from I would say early high school. I just felt that was what I was meant to do, and there's no doubt it's what I'm called to do. I think God places calls on your life. He puts things are placed on you, and you just feel that this is the right thing to do. And I just had a feeling. I had some ideas about some certain things I want to do, and I was like, I kind of want to interview some guys. I want to do this. I want to start this and see how it goes. Started kind of as like we'll talk a little bit of medical stuff, but it's really turned more into mental health type stuff. But for me, it was a call. It's just something I felt called to do. I felt propelled to do. I feel like God placed it on my life to do that, and so I feel really led to do that and everything else. It's been really successful, and we're talking to a lot of guys, and from the feedback that I get, a lot of people are getting a lot of positive responses for it. Now, I say I'm a Christian. Actually, on that podcast, we talked about this a lot on that episode, but I know Southern Christianity is kind of like to a lot of people that's like, but that's not me. I'm a Christian. I believe in love. I believe that everybody should be loved regardless of whatever. And that's the way I view Christianity and all that. But we get into trauma with Christianity. I've been through some myself, in the Christian church and different things like that. But just felt a call to do it. Still feel the call to do it, and it's been really successful. I'm happy with it, man.
Something that I have to have conversations with people because like I'm in the media business. I'm always working with artists and helping them with their music and getting them out in the public and doing things for them, showing them off. And something that I have to get through to them is like you have to be comfortable with bragging about yourself and talking about yourself and building yourself up. And for you to say that you felt called to do this podcast, like, do you ever feel like it is a struggle or it was kind of awkward to like continue to basically fulfill that purpose in your head of like, I need to do this podcast? Because sometimes people get that like, what do you call it? Imposter syndrome, where it's like they feel like, oh, why should I be doing this? And then they kind of psych themselves out of doing the thing that they actually want to do. But for you to say, what you said about that, it's like not only did you feel that way, but you're doing it. Like some people, they feel that way and then they just never do it.
Yeah. Yeah. Well, thoughts that aren't carried out into action are nothing. They're gone. I mean, so you can think about doing something, but if you don't do it, it's not going to get done. Yeah. For me, I think every single influencer, artist, everybody has imposter syndrome to some degree. And I think if you say you don't, you're a liar. I really do because I think often like why if we look even biblically, I'm going to reference the Bible too for a second, but so many people in the Bible were like, why am I called to do this? I think it's human nature, and I think that just points to we have a creator, we have somebody that's greater than us, and so we say why, like, well, I'm a small person, why am I called to do this? But I think to me it's pushing through. I even have those thoughts sometimes. If you have a calling and you're motivated about something, you are very intense about something, you have a passion for something, and it's what you want to do. What is the reason you're not wanting to do it? Is it somebody? Is it the opinion of others who really doesn't matter ultimately? Is it your self worth, your own value? You feel like you're not worth it. You feel like, why me? Well, why not you? You know, why not? Why can you not be? All the people that are successful probably thought the same thing, but they're who they are. That they all probably started at humble beginnings to some degree. So that's what I always think about too. One thing that drives me too about people's opinion, I started YouTube in 2020. I did some financial type videos, got more comfortable talking in front of the camera, all that. Um, but I think, why not me? You know, that's just really the key. Why not? Everybody here too, in this world, we're all gone eventually. Not to get too morbid, but it's the truth. So we're only here for a limited time, and it's very short. I mean, you're 32, 31.
32, yeah.
I'm 32 as well, man. I was just in high school. Like, and it's moving like a freight train. You're gonna let people that we're all gonna go. You're gonna let their opinion of you and what they think dictate what you do. I don't think so. I think just let it go, man. Let it go. Be an artist, be a creator, whatever you want to do. If you have that call and that motivation, you're holding yourself back, man. And you could be the next change in the world. You could change the world. Who knows? But you're going to let your own self doubt, somebody else, hold you back. It's sad, man. You got to power through. And sometimes, even when you get in your head like that, I'm going to choose to do it anyway. I think in the culture today, it's a lot about feelings. I feel scared. Everybody feels scared. Everybody feels afraid. It's about pushing through. It's about having that grit and doing what you need to do anyway, despite how you feel.
Yeah, one of my favorite sayings that I heard a while back was that ships are safe in the harbor, but that's not what ships are meant to do.
That's
And
right.
I love that is because so many people, as you said, they're scared, of like what people might think or whatever. But it's like people are going to think whatever they're going to think, regardless of whether you do nothing or something. People are going to think the same thing. So why not just do
Yeah,
something? Like why not just
exactly.
be happy and do the thing that you want to do? Because even if you do great, people might hate on you and be like, oh, well, you only did great because blah blah blah. But it's like
Sure.
at least you did it. At least you're happy with who you are and the things you're doing.
And two, they may hate out of jealousy that you are even brave enough to do it. People don't even think about that. A lot of the haters that people have is because they're stuck. They're
Yeah.
not brave. They can't do it. They're not motivated enough to do it. And so often we get in this cycle where we're even putting ourselves in their mind. Like we know what they're thinking. They're judging me because of this, and you don't even know. You don't even know. All to say, man, it's a tragedy. It's really a tragedy to me when there's really talented people, really motivated people, and they let their own self doubt or someone else dictate what they do. So sad, man. You got to overcome it. You just got to do it. And doing and doing and doing it repetitively and all that builds that confidence. You just got to keep doing it and be excellent at whatever you do.
Yeah, it's definitely depressing when I meet somebody who's super talented at something and they're just not doing that thing because of how other people might have interacted with them. And that goes back to like what you were talking about with like people having past trauma. Like people
Mm.
might have grown up in a household that was not very encouraging. And so they tend to think that they're not great at anything. And like my mom and my dad, like my dad he wasn't a rah person. Like if I wanted to do something, my dad be like, okay, like go do it or whatever. But like my mom, she would like tell me I'm the best person. Like, oh, you want to do that? You're going to be the best at that. Like that's how my mom was. So as I've grown up, that's just how I've always thought about myself. Like everything I do in my head, I'm like, I'm going to be the best at that. I don't really think I'm going to be literally the best, but like I have that mindset. But that was instilled from when I was a kid. And when I meet people, like as an adult, like being 32 and meeting other adults, it's like, oh, you probably had very encouraging parents because
Right.
I see what you're doing. Like you're doing what you want to do. You're doing the things that you just literally want to do. And if I see somebody who's like not doing things, I'm like, oh, your parents probably just didn't encourage you.
Right. Or somebody else belittled you. You
Yeah.
know, we get in our heads a lot, and create these narratives about ourselves. It's really sad. But yeah, past trauma experience really is everything. And that's so sad for me to see. Your parents are that's what they're supposed to do, man. And a lot of people don't get that. They're supposed to be there they're supposed to tell you you're amazing. I'm so glad you're my son, daughter, whatever else. That's what they're supposed to do. And a lot of people, sadly, in today's age, don't get it, you know. And but it's very, very important. Very, very important, I would say for sure.
And also just like, we were talking about the people around you, like your friends. Like if your friends aren't the type of people who are go-getters and the people who are going to go do stuff, then you're probably not either. And
Mhm.
that's another thing. Like if I just notice a person is doing a lot of stuff, I'm like, oh, they probably have friends that are doing things too, that are also that type of attack mindset, that go-getter mindset. And if a person's not, then I probably just notice the people who's around them, and I'm like, oh, you're just doing the same thing that the people you hang out with are doing. They're doing nothing, so you're probably going to do nothing.
Sure. Well, that energy is attractive, and so if you're on that level and other people don't want to be on that level, that's kind of unattractive to you. You're like, well, you're not trying to be better like me, not really a good fit. And so I think those energies kind of attract each other. But yeah, the quote, who you're around is who you're going to become, and it's the truth. Got to surround yourself with good people for sure. That uplift you. Very, very important.
How does that work with just your medical field? Like, does it seem like the doctors or the other people that you like nurses, whoever that you surround yourself with, do they have like a kind of like a plateau in the career field, or are you like constantly trying to like strive to do other things? Like, how does that work?
For me, it's excellence. The people that I'm around, and even in my clinic, I set the tone, with the people around me. We're going to deliver good care. We're going to treat people well. We're going to work to the best of our ability, and that's just what we do. And so, a lot of people around me, we all aggregate together, work together as a team, and do that. But it's always trying to be better. A lot of the people in my clinic are actually going back. If they're a medical assistant, they're going to be a nurse. If they're whatever, they're trying to advance. They're trying to be better, and that's what I always try to instill in them. But as far as having other clinicians around me, because I've reached the doctorate level, so it's kind of like, where do I go from here? But there's always more that I can do. It's even if I'm not doing education, I can do stuff like this. I can talk, I can do other things. I created the podcast. I can do other things that help people and propel, me and other people forward. And that's what I look for in other people, other providers, other clinicians. Try to surround myself with other good people like that are trying to be better every single day.
Yeah, and when you're in that kind of, if you're like an officer in the military or a doctor, like these positions that a lot of people look highly upon as far as like, I mean, borderline leaders of humans. Like people look to them for information. And I think that when you're in those kind of positions, like you can kind of weed out the people who maybe didn't do the things that most people would think are what's the word, like integrity to get to that position. Like a lot of people, they get to a certain point because they had, I'm going to say, not the greatest intentions of why they got to that point. Like some people might become a doctor without the greatest intentions, and then their work kind of shows. But then there's some people who just genuinely just wanted to help people. And so I think when you kind of can see that, like the difference between people of like how well they work because of their motive of why they got to that position.
Oh, you can see it, and the patients can see it. The patients know. They know who cares. They know who's really there and invested in them. The patients see it, but yeah, everybody has a motivation. Not to get too deep psychologically, but we're all motivated by something, and but finding people that have those similar motivations, I think that's with any area. Find people that have similar motivations than you. Are you trying to be a good person? Are you trying to do the right thing? Are you trying to be ethical? Are you trying to build other people up around you? what's your motivation in life? What are you trying to do? And I think surrounding yourself with like-minded people is really the key. But yeah, if you go to a doctor's office, doc in the box, wherever you go, whatever, even the nurse, the front desk person, the provider, you know that they care or not. Everybody knows that. You know it. You know if they're motivated by either greed or whatever else. You know that.
Yeah, my wife had went to a doctor one time for like her foot or something like that, and it was a female doctor, and I just didn't like when we were talking to her, her responses just kind of rubbed me wrong. And she was just basically, she was joking around about Rachel saying that she wouldn't want to take pills and stuff like that. Because Rachel always tries not to like take a pill for something. She wants to find a different alternative. And
Sure.
she will do it, but she just wants to find the alternative first. And the doctor was like, well, I would suggest this, but you wouldn't take it and stuff like that. And I was just like, what is going on? I was like, Rachel, do not go back to the
Yeah,
doctor.
that's pretty strong. I always try to respect people that don't. Now, I will tell them, and a lot of supplements are regulated by the FDA, so I don't research them routinely. But I always tell patients if you take a supplement, you don't have side effects. It doesn't interact with the medicine you're taking or whatever else. You should do it. Why not? Like, why not? If that works for you, because really everybody's chemical makeup is different. We could spend millions of dollars per person, find your blood type, or like down to the biomarkers of your DNA, and really make a catered plan. But that's not cost effective. We can't do that. So a lot of stuff is just trial and error. A lot of people don't want to say that, but it is. Some medicines work for some, don't work for others. Same with supplements, same with herbal remedies, whatever. But I wouldn't bring it to that. Say, oh, I'm not going to do this because that's pretty abrasive there. Pretty abrasive.
Yeah, it was kind of strange, but I was like,
Yeah.
don't go back there.
But you see, just like with any profession, though, there's all kinds of people. It's you just never know. You never know.
Does it seem like the people that you do work with, do you feel like the education of medical students is, I guess ethically taught correct, or does it seem like it's just per the person? Like, oh, you just go to school and your personality is just whatever it is. Like, we obviously know that there are some good cops out there and there are some bad cops out there.
Sure.
Uh, you can go through a police academy but still be a horrible person. And it doesn't, it's irrelevant. So, do you feel like that ethically, um, medical people just tend to just their personality just shows no matter what?
Yeah, I think some people can change with information, but I think a lot of it from the medical field is just like the police force. You can lead a horse to water, they're going to drink. I think that's really the basic concept. You could sit through class after class and all that. If you're not a great person, you don't care about what you do, you're there for the money, and even you don't care about the goodwill of people. There's people like that. Can't really relate. But if you're like that, a class probably is not going to change you. You know, that's the big argument with, I don't know, can we say police brutality? Can I say that?
Yeah, go ahead.
Okay, I don't know if it get flagged or whatever. Sometimes my podcasts get flagged with weird stuff,
Oh,
but
really?
even police brutality, you could give them tons of classes, and people are going to still go out and harm people and all that, just because either they're dealing with something, which doesn't excuse it, but at least you understand they're probably dealing with something on a personal level, or whatever else. A class is not going to fix that. So I think it's the same with education, but that is also what makes everybody so unique. You can see me, I'm pretty upbeat energy. There's a lot of providers. Some people want a calm, like a really quiet provider, and that's fine with them too. We're all different in that aspect, but but I think it's just following ethics is really the key. You got to do that. I mean, that's number one. You know, I'm a doctor of nursing practice. Physicians, they take a vow, don't do no harm and all that. Um, you know, ethics is really at the forefront. That needs to be the primary thing. And but yeah, you can lead a horse to water, can't make him drink, man. You can have people take a bunch of classes, but until they want to change, until they want to see their own ignorance, which isn't a negative term, it's just you don't know, you're ignorant, you just don't know. You're not going to change.
This is random, but thank you for saying that because I always grew up thinking the word ignorant meant like you didn't know something and you like were choosing not to know something. So I
Right.
always had a negative connotation to it. But now I'm like, oh, that just means you literally just don't know something.
But people use it abrasively, like you're ignorant, and they'll point a finger at somebody.
Yeah,
Well, I mean, and I think that's why there's a negative connotation with that term, but it's just that you don't know. Shout out to Wes Beck. He actually, one of a friend of mine, he actually explained that very, very well on the podcast that I was on. But it's just that you don't know. And so if you're ignorant to something, be open. Be open to at least listen. Try to see things from a different point of view. That can really change the world, honestly, if everybody just does that.
absolutely. So going back to just the people that you've had on your podcast, what I guess go ahead and explain to people kind of like how it's set up. You did say it's the Better Man podcast, and you just went to have on some people to talk about like the things that have happened in their life and how they're becoming a better person and just a good person in society. But like, how do you kind of pick these people? How does that kind of set up?
Well, a lot of it's from social media. Personally, now I have an email. I'll give you all this stuff. You can put it down in the description as well. People message me and say, "Hey, I want to be on," and all that. But some of it's when I started, it was just personal friends. Just friends, and then I saw other people that were really successful in their craft. And I was like, I'm going to message them and just see if they want to hop on, and they did. A lot of them did. Turned out really, really well. But that's really been my selection process thus far. I know with most podcasts, that's the issue is finding people to get on. And there's actually agencies you can pay. You pay them money to go find people to connect with you and all that. Because it's a real struggle. But for me, it's just been word of mouth. As it's grown, more people have been inquisitive. They've wanted to be on and wanted to be a part. And then just me direct messaging some people saying, "Hey, I think you'd be a good fit for this. I kind of want to hear your story. Let's sit down and talk for an hour or two."
That's pretty cool. And I use this website. Gosh, what was it called? Man, I don't remember. But there was some website I used to use that I literally had the number one podcast in the world on their website at one point. But
Oh wow.
I was doing so many podcasts. I was doing probably like 20 something in a week. And
Oh my gosh.
yeah, it was great. But I stopped doing it because the amount of money it was paying out just didn't equate because I was like, okay, I'm spending how many hours? Because my podcasts are usually about an hour. So I'm like, I'm spending how many hours and I'm making this much money. Granted, was it cool that because I was just doing my podcast for free, but I was now making money off of it, but it wasn't that much money. So I was like, I'm basically working like this many hours and it's not even that much money. So I'm like working for way dumb cheap. So I just had to stop doing it. But it was cool like having that many people on because people would just contact me and they'd be like, "Hey, I want to come on your podcast." And because I was like number one at one point in the world, so
Yeah.
like everybody wanted to be on my podcast, but it just got too much and I couldn't sustain it. But yeah, that's cool that that's how you pick them though.
Yeah, it's pretty good. But I know, people want to see that success. And then once they see it, a little taste of it, they'll, hey, I kind of want to be a part. And that's kind of what I've done with my podcast slowly. It's a side thing for me now. It's grown a lot. I have over 3,000 subscribers on YouTube and it continues to grow and do really, really well. But I'm a medical provider. That's my main thing. I think a lot of people kind of want a side hustle kind of thing. And yeah, it doesn't pay well, but it's a hobby for me. I connect with people, I enjoy it, and I love doing it, man. It's really, really fun.
What's something that you feel like people should get from your podcast? Like, hey, you should really understand this about my guest or from me, the message that comes from my podcast.
That you're not alone. That you're not alone. That just the struggles you have, everybody has, man. And it's mainly catered to men in that aspect. So I have some women listeners. But it's mainly to men that just you're not alone, man. I think it's hard for men today, bro. I'd say harder than ever. It's just tough. There a couple of years back, it was almost anti men. There for a while, I feel like the culture. I don't know what happened. I don't know, but you're not alone, man. The loneliness, the struggle, the same things that I've been through, that my guest, everybody has been through, and just to have that community. of other people that says, "Hey, man, I'm struggling just like you. You're not alone. You're not a terrible person. You're not all this. You're just like me." And that's really the message that I want to send. We talk about tons of different topics on the podcast, just whatever kind of comes up. But that's the central message is that everybody has a past. We're living now in the present, and every day we're trying to be better, the better man in the future. So that's what I always try to convey to my audience.
Well, man, it's been great talking to you. I guess let's go ahead and wrap this up. But well, I mean, it was awesome talking about your medical history, how you got there, the things that you're currently doing for everybody, and then also just your podcast in general. If you could, though, I guess tell everybody how they can reach out to you, if they need a doctor to talk to, how they can reach to you, and then also just how they can find your podcast.
Sure. So at Dr. Jared Nelson, at Dr. Jared Nelson on Instagram, Dr. Jared Nelson on YouTube, and I'm a medical provider. I don't know how wide your audience is, probably global, I assume, but here in the Alabama area, I work for a company called Quality of Life, not representing them on this podcast. But yeah, I guess if you send me an Instagram DM, you could have an appointment with me, whatever. I'll set something up, get you to the person that you need to go to. Would be glad to be your medical provider, take care of you. Whatever you need, I'm here for you.
And then also your podcast.
Yeah, so it's Dr. Jared Nelson on YouTube, but we're on Apple Podcast, Amazon Music, Spotify. If you search The Better Man with Dr. Jared Nelson, it'll pop up there for you. 42 episodes for you to listen to.
Awesome. Well, thanks again for coming on, and I look forward to. And you said you wanted me on yours, right?
Yeah, absolutely. Absolutely.
Cool, cool, cool. Well, yeah, I look forward to doing that as well. All right. Well, thank you for everybody for tuning in, and we'll see you next time.